Now we'll discuss one of the most important topic, that is vitamins. So what are vitamins? Vitamins are the organic compounds which are very essential to the body in minute amounts. So for a human being, in order to have his diet proper, we require various elements. So apart from vitamins, we require carbohydrates, minerals, fats, vitamins and micronutrients. The nutrients which are essential to the human body are macronutrients and micronutrients. So in micronutrients, minerals are present, as minerals are categorized under micronutrients, and under macronutrients, carbohydrates, fats, vitamins are come under this category. So in order for a person to have his nutrition in a proper way, or in order for a person to have his balanced diet, then all these organic compounds should be taken in a proper amount. Then only the person will receive proper amount of nutrition which is required every day. So vitamins. Certainly vitamins are the essential macronutrients which are required for the body, and these are organic compounds which have to be taken in a smaller amounts. So these vitamins, the name itself indicates vitamin. Vital means it is essential. Vital is, it's vital for the life. It's very essential for our life, and these vitamins are considered as micronutrients, and which are very essential to the body. And these are micronutrients, we have to administer them at the dose of microgram to milligram. These vitamins are classified into two types: vitamins, fat soluble vitamins and water soluble vitamins. So under water soluble vitamins, vitamin B complex as well as vitamin C. So in why we call it as a B complex? Because it is a combination of various types of vitamin B. So that is the reason it is called as vitamin B complex and vitamin C. And fat soluble vitamins like vitamin A, D, E, K. What is the difference between these water soluble and fat soluble? Why they are categorized as water soluble and fat soluble instead of considering all under one category? So here we can see the difference. These water soluble vitamins, they are not stored in the body at all. We have to give them as an external source. They are not stored in the body, or they cannot be present in the body. Whereas fat soluble vitamins, they can be stored in the body, and there's no need for them to give as an external source until and unless there occurs deficiency of that particular vitamin. And why these water soluble vitamins, they are excreted in the urine, and when they are excreted in the urine, there is no chance of accumulation of these vitamins in the body, and thereby they are not toxic to the body. Whereas fat soluble vitamins, as they are stored in the body, there may be chances of these vitamins accumulating in the body, and they may cause, in some cases, if they are present in large amount, they may cause overdose or toxic to the body. And these water soluble vitamins, they are unstable to heat, light. In the sense, if excessive heat is present in the body, these vitamins becomes unstable. In the sense, we can say they get degraded. But these fat soluble vitamins, they are very stable to heat, light or normal cooking temperatures also. But with these water soluble vitamins, there are various sources of these water soluble vitamins. So for example, we can take like green leafy vegetables. If we cook these green leafy vegetables under high temperatures, then these vitamins are lost out of that source. Then we won't get vitamins which are required for the body from that particular source. Let us see in detail now about water soluble vitamins. So water soluble vitamins include vitamin B complex and vitamin C. Let us see in detail about vitamin B complex. So what are the sources of these vitamins? What are the functions of these vitamins, and what happens or is what might be the consequences if this deficiency occurs with this vitamin? So the first vitamin under this B complex is vitamin B1, which is also called as thiamine. So this vitamin B1 is a rich source of us. These vitamin B1 is present richly in meat, oatmeal, cereals, fish, egg, as well as milk and fortified white flour. So these are few of the sources of vitamin B1. This is the structure. Why I'm showing this structure is that because vitamins, when entering into the body, they undergo some biotransformation reactions, or we can say that they play a very key role in few of the biotransformation reactions which are occurring in the body. So the structure is very important, because one of the group which is present in this vitamin structure play a key part in that biotransformation reaction. So this is the structure of vitamin B1 or thiamine. Let us see the functions. So this thiamine plays a very important role in nervous system. You can see it is aided in proper functioning of the nervous system, and this thiamine plays a very important role in energy release. It is very important in formation of ATP, which is the main source of energy. So energy release is aided by thiamine, and it is necessary for appetite and good health. If we take thiamine, it makes the person to feel appetite. So if a person is taking a healthy diet, then he will be healthier always. So it aids in the appetite of the person. What are the properties of the this thiamine? So how does it look, or what are the characteristic features? So it is a water soluble, because it comes under the category of water soluble vitamin. It is highly water soluble, and it is destroyed by higher temperature. We have already discussed this point in differentiation of water soluble and fat soluble. All water soluble vitamins are unstable under higher conditions, and they are destroyed by alkalis. So in alkaline condition, or if there is any alkaline product or organic compound which is present in the body, it reacts with that alkaline compound. For example, we can say sodium bicarbonate or calcium carbonate, or these alkaline substances or phosphate groups. It easily reacts with those, and it forms various products. So it is degraded in alkaline condition, and it is lost by milling flour. So we can see that thiamine is present in fortified wheat flour or white flour. So this fortified white flour, when it is milled for, or else we can say when it is milled for a long time, then this thiamine is lost. Thiamine is getting degraded because of the pressure which is created during the milling, and it causes leaching into cooking food. So while we cook, while we cook in a higher temperature, because of the higher temperature, this thiamine is getting degraded. So we have to make sure that this thiamine is not lost out of the out of it from its sources. And what is the daily requirement? These vitamins are the organic compounds, so they should be given in very smaller amount. Higher doses as well as lower doses are not recommended. So the dose of this thiamine which is given daily is 1 mg per day. It's not based on the gender. Apart from any gender, we can give it to any gender. 1 mg per day is recommended. So this thiamine, how does it get absorbed, or else what are the pharmacokinetics of thiamine? So it is well absorbed in the duodenal region of GIT. So in the GIT, especially in the duodenum region, this thiamine is well absorbed. And the absorption of thiamine takes place by two processes. One is active transport, the other one is passive transport. Through active transport, low levels of thiamine is getting absorbed, but through passive transport, higher levels of thiamine is getting absorbed. So what are these active transport and passive transport? So active transport is a type of transport where the transportation of molecules takes place without usage of any energy and any carrier. So directly the molecules get absorbed into the cells, whereas in passive transport the molecules don't penetrate into the cells. So that is the reason they require some carrier in order for the molecule to take place into the cell. So as this thiamine is water soluble, it cannot pass through the cell membrane, so it needs some carrier. So in that condition, this carrier carries the thiamine into the cells, and where it requires some energy, so it utilizes some energy for this process. So that is called as passive process. So in active process, low thiamine levels are absorbed, whereas in passive transport, high level of thiamine is getting absorbed in the duodenum. What are the biochemical functions, or else why thiamine is useful, or how thiamine is useful in the biological system? So in the biological system, it undergoes, or else it is useful in various biochemical reactions. For example, there are various types of biochemical reactions. So oxidative decarboxylation reactions. So oxidative decarboxylation reaction is a one type of biotransformation reaction. In that we have pyruvate dehydrogenase. So pyruvate dehydrogenase is an enzyme which is required for the conversion of pyruvate to acetyl coenzyme A. So when this pyruvate, here we can see the reaction, when pyruvate is reacting with coenzyme ASH, there are various types of coenzymes. So one of the type of coenzyme A is coenzyme ASH. Coenzyme ASH, nothing but coenzyme A which is having SH group, that is sulfhydryl group. So this pyruvate, when it is combining with this coenzyme A, by the utilization of NAD, that is nicotinamide adenine dinucleotide. So this is a coenzyme which is required for various biotransformation reactions, NAD and NAD plus. So this, when it utilizes this coenzyme A in the presence of TPP enzyme, that is thiamine pyrophosphate enzyme. So in the presence of this enzyme, it is forming acetyl coenzyme A, and it releases carbon dioxide and it releases NADH, that is nucleotide adenine diphosphate hydrogenase and H plus ions. So this in this reaction, thiamine plays a major role. The other type of reaction is alpha ketoglutarate dehydrogenase. So in this this enzyme is very useful in the conversion of alpha ketoglutarate to succinyl coenzyme A. So here in this also thiamine pyrophosphate along with the alpha ketoglutarate dehydrogenase, it utilizes coenzyme A and NAD plus, and it is converted to succinyl coenzyme A, plus it releases NADH and protons. And what happens if deficiency of this thiamine occur, or else if thiamine is not present in the required amount in the body, it causes a condition called as BERI-BERI. Apart from that, it causes heaviness of legs. I mean, the legs will to the legs some weight is added because of inflammation or various other reasons. It causes anoxia, and it causes it makes the persons to feel weak. Mainly it occurs, or else it causes some kind of inflammation or some injury to the legs. And this BERI-BERI, the main disease which is caused because of the deficiency of thiamine is BERI-BERI. So this BERI-BERI is of three types again: wet BERI-BERI, dry BERI-BERI, and infantile BERI-BERI. What is wet BERI-BERI? So in this wet BERI-BERI, we can see the person is suffering from serious manifestations. That is, the person will have the disturbances in the cardiovascular system. The person will have abnormal ECG, that is electrocardiogram, and the person will have abnormal blood pressure, and there occurs in severe conditions it may lead to heart failure also, and it causes edema of legs, that is swelling of the legs or face as well as trunk region. It causes a damage to that particular tissue, and it causes it makes the calf cells, the calf muscles which are present, they become tender, or else they become fragile, or else we cannot walk, the person cannot walk properly, and it causes the disturbances to the cardiovascular system. Because of that, where the heart won't function properly, and it may cause failure of the heart also. Dry BERI-BERI. What is dry BERI-BERI? In dry BERI-BERI, CNS manifestations we can observe. It means it causes damage to the central nervous system, whereas in wet BERI-BERI it causes damage to the cardiovascular system. In this dry BERI-BERI, the muscles become very weak. The person will become very lean, and he will lose the muscular weight, and thereby as it acts on the CNS, it causes peripheral neuritis. Peripheral neuritis is a condition where the damage is occurred to the nervous system or the nerves which are present in the peripheral nervous system, and in severe conditions it may lead to paralysis of the peripheral nervous system as well. infantile BERI-BERI. So this is a kind of BERI-BERI which is caused to the infants, and in this infantile BERI-BERI, the child or infant will suffer from restlessness, sleeplessness, and it may cause acute cardiac failure also for that particular infant. The second vitamin of B complex is vitamin B2 or riboflavin. So this vitamin B2 is richly present in offal. It is one kind of meat product, and the other one is milk, cheese, eggs, yeast extracts, green vegetables, and enriched grains. This is the structure of riboflavin. It is a complex structure. What are the functions of riboflavin? So riboflavin plays a major important role in the metabolism of micronutrients like carbohydrates, fats, and proteins, and it is also very essential in the growth of a person. So in order for a person to grow, the riboflavin plays a major important role because it aids in the development of the body tissues. If we take riboflavin in proper amount, then it may aid in the proper growth of the children. And the other is, it is a principal growth factor for promoting vitamin B complex. So it is one of the cofactor, we can say it is one of the cofactor in the formation of other vitamin B complexes. What are the functions of these vitamin B complex in the body, or else we can say biochemical or biological functions of this vitamin B2 or riboflavin. So this vitamin B2 plays a major important role in the formation of two coenzymes, that is FAD and FMN. FAD is flavin adenine dinucleotide and FMN is flavin mononucleotide. So these are the two enzymes which are mainly useful in biotransformation reactions. So this vitamin B2 or riboflavin plays an important role in the formation of these two enzymes. What are the properties? So the main properties are, first thing, they are water soluble and they are unstable at higher temperatures. They are destroyed with alkalis, and this vitamin B2 is light sensitive. So when it is exposed to light, it gets degraded. And the daily recommended dose of this vitamin B2 or riboflavin is 1 to 1.5 mg per day. Let us see how riboflavin is essential in this FAD type of dependent reaction, that is flavin adenine dinucleotide. So in flavin adenine dinucleotide, this coenzyme or this enzyme is useful in various biotransformation reactions. So first type of biotransformation reaction is conversion of succinate to fumarate. So when succinate is a compound where it utilizes an enzyme called as succinate dehydrogenase, and when this succinate utilizes succinate dehydrogenase and it is converted to fumarate with the help of FAD. It utilizes FAD and it releases FADH2. And the second type of reaction is acyl coenzyme A dehydrogenase. So acyl coenzyme A dehydrogenase, where it is involved in the conversion of acyl CoA to alpha beta unsaturated acyl CoA. So this is one of the steps which is involved in the fat metabolism. So this in the fat metabolism, where this acyl CoA is converted to alpha unsaturated acyl CoA in the presence of an enzyme called acyl CoA dehydrogenase. So in this particular reaction also FAD is utilized and it is released in the form of FADH2. The other one is xanthan oxidase, is an enzyme which is useful in the conversion of xanthan to uric acid. So this uric acid is formed when the xanthan metabolism takes place in the presence of an enzyme xanthan oxidase, and it also utilizes FAD and FAD is released as FADH2. And these are FAD type of dependent reactions. Let us see FMN dependent reactions. There is only one reaction where the conversion of L-amino acid to alpha keto acid takes place. So this is amino acid metabolism. So the L-amino acid, it utilizes the enzyme called as L-amino oxidase and FMN, and it is converted to alpha keto acid releasing ammonia, that is NH3, and this FAD is converted or else it is released as FMNH2. what happens if riboflavin deficiency takes place? So in riboflavin deficiency, if riboflavin deficiency is occurred, it causes chelosis. Chelosis is a condition where the inflammation of mouth takes place. The other one is angular stomatitis. So this is a condition where the inflammation occurs at the angles of the mouth. And the other one is glossitis. Glossitis is a condition where we can observe the magenta coloration of the tongue. And the other one is it causes inflammation of the sebaceous glands. So in the skin we have sebaceous glands as well as sweat glands. So sebaceous glands from which sebum is released, which is adding oiliness, or as we can say it adds some oily structure to the skin. It gives some sort of glow because of the sebum which is released from the sebaceous glands. So when this inflammation occurred, when this riboflavin deficiency occurs, it causes inflammation of the sebaceous glands, leading to a condition called as seborrheic dermatitis. Here we can see the glossitis condition where the magenta coloration is observed to the tongue, and in angular cheilitis the inflammation has occurred at the angles of the mouth. The third vitamin is vitamin B3, that is niacin or nicotinic acid. So niacin is richly present in meat, offal, yeast extracts, yeast, bran, wheat germs, flours, some pulses, and it is present in dry fruits. This is the structure of niacin or nicotinic acid. So, what are the functions of niacin or nicotinic acid? So, niacin plays again a major role in the metabolism of carbohydrates, fats and proteins like the riboflavin. So, riboflavin and niacin, they play a very major important role in the metabolism of these carbohydrates, proteins and fats. And it is also very essential in the normal functioning of the nervous system. So it shows the actions of again thiamine. Thiamine and niacin plays a major important role in the functioning of nervous system. What are the properties? So first property is it is water soluble, and unlike all other vitamin B complexes, this niacin is stable to heat. Why it is stable? Here we can see the structure. In this structure, it contains a pyridine ring along with COOH group, that is carboxylic acid group. So because of this structure, this niacin is very stable to heat, and it is fairly stable to alkalis also. Thiamine as well as riboflavin, they degrade in the alkaline condition, but here this nicotinic acid, it will be stable in the alkaline condition also. And but when milling is occurred, or as when it is a source of, it is present in flours also. When milling of these flours occur, then 80 to 90% of this niacin or nicotinic is lost out of that particular source. And it is recommended to give almost 15 to 20 milligram per day. What are the therapeutic uses of this niacin or nicotinic acid? So this nicotinic acid plays a major important role in the lowering of plasma cholesterol. Why? Because this niacin or nicotinic acid is very useful in fat metabolism. So in fat metabolism, when this fat metabolism takes place, then the plasma cholesterol levels will be reduced. So here we can say it is a very important it is a very important in formation of two coenzymes, that is NAD and NAD+. That is nicotinamide adenine diphosphate and nicotinamide adenine monophosphate. So these are the two coenzymes which are formed with the help of this niacin or nicotinic acid. And the biotransformation reactions which involve this NAD and NAD+, this niacin or nicotinic acid plays a major important role in that particular biotransformation reactions. So let us see NAD plus dependent biotransformation reactions. So there are two types of reactions which are occurring in the body which use NAD plus with the help of or else in the presence of niacin. So that is glycolysis. So glycolysis is a process which takes place in the mitochondria of the cell. So in the cell we can find mitochondria. So it is a structure where in the mitochondrial structure we can see a tube-like, or else we can see a structure, a celluloid structure where this glycolysis takes place. So in this glycolysis there are various enzymes present, but mainly while the utilization of glyceraldehyde 3-phosphate dehydrogenase and lactate dehydrogenase, in this particular step only the NAD+ is utilized. Here we can see the diagrammatical representation of this glycolysis. So glycolysis is the conversion of glucose to pyruvate, plus it releases 32 ATPs. So the net result of this glycolysis is the metabolism of carbohydrates, that is the conversion of glucose. So when glucose is converted from various steps, the glucose undergoes various steps of conversion, and finally it is converted to pyruvate or pyruvate, and along with that 32 ATP are released. So this 32 ATP are the energy source. That is the reason when glucose undergoes metabolism, high energy is released, because from the conversion of one glucose molecule 32 ATP are released. So just imagine how many glucose, if more conversion of glucose takes place, lot of energy lot of energy is synthesized in the body. Here we can see the glucose is converted to glucose 6-phosphate, and from glucose 6-phosphate fructose 6-phosphate, fructose 6-phosphate to fructose 1,6-bisphosphate, and from fructose 1,6-bisphosphate the glyceraldehyde 3-phosphate is formed. And here this is the main step where NAD+ is utilized, and niacin plays a very major important role. So here the conversion of glyceraldehyde 3-phosphate to 1,3-bisphosphoglycerate, here the glyceraldehyde 3-phosphate dehydrogenase is utilized. So in that particular step NAD+ is used for this conversion. The next biotransformation reaction is TCA cycle. So TCA cycle, tricitrate cycle, where it utilizes various enzymes, but main important enzymes are pyruvate dehydrogenase, isocitrate dehydrogenase, alpha ketoglutarate dehydrogenase, and malate dehydrogenase. So these are particular enzymes which utilize NAD+ for their conversion. This is the diagrammatical representation of this TCA cycle. Here also the pyruvate is converted to citrate, and this is a circular, or else we can say it is a cycle. It is not like glycolysis. So in glycolysis the glucose is converted to pyruvate. Here the pyruvate which is formed in the glycolysis, it is utilized in the TCA cycle, and this is a chain like cycle. It is a continuation. So here the pyruvate is converted to citrate. So we can see the citrate is converted to isocitrate, isocitrate to alpha ketoglutarate. So when this isocitrate dehydrogenase is an enzyme which utilizes NAD+. So here the conversion of isocitrate to alpha ketoglutarate, we can see isocitrate dehydrogenase is utilized, and alpha ketoglutarate is converted to succinyl coenzyme A, where alpha ketoglutarate dehydrogenase enzyme utilizes NAD+, and succinyl to succinate, succinate to fumarate, fumarate to malate, and from malate to oxalate, malate dehydrogenase enzyme again utilizes NAD+ for its conversion. And in the first step itself, where pyruvate is converted to acetyl-CoA, in that pyruvate dehydrogenase enzyme is utilizing NAD+ for its conversion. The third biotransformation reaction which is utilizing NAD+ is amino acid metabolism. So in this amino acid metabolism, there are branched chain of alpha keto acid dehydrogenase. This alpha keto acid dehydrogenase enzyme is a complex of various enzymes. So this is a branched chain which utilizes the NAD+. The other one is glutamate dehydrogenase. So here we can see the diagrammatic representation. Here also pyruvate is converted to oxalate again. It undergoes this. In this cycle, the various amino acids are utilized. For example, leucine, lysine, phenylalanine, tyrosine, isoleucine, tyrosine, phenylalanine. So here in this conversion, when the amino acids can't be used as such, so they have to undergo metabolism. So in this metabolism, the alpha ketoglutarate dehydrogenase branched chain as well as glutamate dehydrogenase, where the conversion or metabolism of glutamate amino acid is taking place. So in that particular reactions, NAD+ is utilized. The other one is fat metabolism. So in fat metabolism, the various polyunsaturated fatty acids are converted to simpler fats where the beta hydroxyl acetyl coenzyme A dehydrogenase and beta hydroxybutyrate dehydrogenase. So these are very important enzymes which are used in the fat metabolism. So this in these two enzymes utilize NAD plus for their conversion. What happens if deficiency of this niacin or nicotinic acid takes place? So if deficiency or else niacin or nicotinic acid is not present in the body in proper amount, it causes a disease called as pellagra. Pellagra is a 3D disease. 3D disease in the sense it is involved with dermatitis, dementia and diarrhea. So dermatitis is a condition where skin inflammation is caused, and diarrhea, that is watery stools, and the other one is dementia. Dementia is abnormality thinking, or we can say memory loss. So this conditions or pellagra is occurred in the deficiency of niacin or nicotinic acid. The next vitamin B complex or vitamin which is present as vitamin B complex is vitamin B5 or pantothenic acid. So this pantothenic acid is present richly in foods, various other foods, especially in organ meats, mushrooms, avocado, broccoli as well as whole grains. This is the structure of pantothenic acid. So let us see how this pantothenic acid is formed. When pantoic acid, it combines with beta-alanine. It is an amino acid. So when this pantoic acid is combining with beta-alanine acid, then this pantothenic acid is formed. So what are the functions of this pantothenic acid? So this pantothenic acid plays a major important role in the formation of coenzyme A. So this coenzyme A, it is synthesized by the formation, or as we can say the combination of cysteine, pantothenic acid, AMP and phosphate. AMP is adenine monophosphate. So the coenzyme A is formed when cysteine is reacting with pantothenic acid in the presence of AMP and phosphate. So it is a very important vitamin which is essential for the formation of coenzyme A, and this coenzyme A is a very important enzyme which is used in various biotransformation reactions in the body. And what are the functions of the coenzyme A? So this coenzyme A, it is occurring in various forms. We can say coenzyme A, coenzyme ASH, coenzyme AS. It depends on the group which is attached to the coenzyme A. In coenzyme ASH, the hydroxyl or thiol group, a sulfhydryl group, SH group is attached to the coenzyme A. Whereas in coenzyme AS, sulfur group is attached. So this coenzyme A, which is this thiol group is the carrier. We can say the group which is attached to this coenzyme A is the carrier for the transportation of this coenzyme A. So here we can see the biochemical role or biological functions of this pantothenic acid. So it is mainly used in the metabolism of carbohydrates, fats as well as proteins. Here the carbohydrates are converted to pyruvate because we saw the conversion of glycolysis where glucose is converted to pyruvate. So the carbohydrates, that is glucose, is converted to pyruvate, and this pyruvate utilizes alanine, gluconic acid and various other amino acids to form acetyl coenzyme A, because the pyruvate we saw in TCA cycle also and in amino acid metabolism where pyruvate is converted to acetyl coenzyme A. So this is mainly the rate limiting step where the pantothenic acid is utilized. So here pantothenic acid along with cysteine is formed, is involving in the reaction where the pyruvate is converted to acetyl CoA, and this acetyl CoA enzyme is useful in various reactions like fatty acid metabolism, acetylcholine formation and cholesterol synthesis, TCA cycle as well as ketone body metabolism and detoxification metabolism. So these are various biotransformation reactions which involves acetyl coenzyme A. And here we can see few other reactions like the alpha ketoglutarate. Alpha ketoglutarase is converted to succinyl coenzyme A by utilizing the thiamine. So here the succinyl coenzyme A, it is formed by other reactions like odd chain fatty acid metabolism. The fatty acids, long chain fatty acids which are containing odd number of groups, odd number of carbon atoms, along with thionine, valine and isoleucine metabolism. So when all these metabolism reactions take place, succinyl coenzyme A is formed. Here also this pantothenic acid plays a major important role. And this succinyl coenzyme A is a very important enzyme which is used in glyconeogenesis. So glyconeogenesis is a process where glucose is formed from other substances like glyconeogenesis. Glyco means glucose, neo means new, and genesis means formation. Glucose is usually formed from carbohydrates, but apart from carbohydrates, the newer substances, that is fats and proteins, it depends on the enzyme which is acting on that. There are various pathways for the metabolism. So it depends on the enzyme which is acting. So in the gluconeogenesis reaction, the succinyl coenzyme A plays a major role, and the activation of acetoacetate, the conversion of acetoacetate. Acetoacetate is a group which is formed by the fatty acid metabolism. So in that step, and in energy production in drug metabolism, the succinyl coenzyme A is utilized. And this pantothenic acid is recommended to give in a dose of 5 to 10 mg per day. What happens if deficiency of this pantothenic acid takes place? So if this pantothenic acid deficiency takes place, it causes burning sensation to the feet, and apart from that, it causes sleeplessness. The person becomes tired, or else he won't feel sleepy, or else he won't have proper sleep if pantothenic acid deficiency is taking place. And this person, or else this pantothenic acid deficiency, is usually observed in the patients who are having renal failure or renal problem, or else in chronic alcoholic person. If a person is alcoholic, or if he is taking alcohol for longer period of time also, this pantothenic acid deficiency will occur. The next vitamin is vitamin B6 or pyridoxine. So vitamin B6 or pyridoxine is richly present in meat, offal, eggs, yeast extracts, fish, soya chunks, potatoes and green leafy vegetables. So this is the structure of pyridoxine. What are the functions of this pyridoxine? So this pyridoxine play a major important role in protein metabolism. It is not involved in any other carbohydrate or fats metabolism. It is exclusively used in the protein metabolism. So, and it is also involved in the formation of hemoglobin. Hemoglobin is very essential for a component of blood. So this vitamin B6 or pyridoxine plays a major important role in the formation of hemoglobin, as well as in the formation of structural proteins, that is albumins, which are required in the body. These are the structural blood proteins, which are present in the blood. So in this protein formation also, this pyridoxine plays a major role, and this is very useful in the proper functioning of nervous system. What are the properties? So the properties of this pyridoxine is that it is water soluble and it is heat stable. So this is also stable to heat, and it is sensitive to high temperatures, oxygen milling and processing. So this pyridoxine, it can withstand heat up to only some extent, but if the temperature is exceeding, or if the temperature is high, then this pyridoxine gets degraded, and it gets even degraded because of the milling, because it's present in rice grains and rice polishing also. If the milling of this occurs, then this pyridoxine is lost, and if it is when this pyridoxine is reacting with oxygen also, it degrades. So that is the reason it is very sensitive to oxygen, and this pyridoxine is given in the dose of 2 mg per day. And there are various forms of this vitamin B6. So let us see. First one is vitamin B6 of pyridoxine. The other one is pyridoxal. The other form is pyridoxal phosphate, and the other one is pyridoxamine. These are the structures of various forms of this vitamin B6. Here we can see pyridine structure. This is the main structure or as main component in the pyridoxine group, because of the presence of this pyridine group only this pyridoxine is active. So this pyridine, and in pyridoxine we can see the hydroxyl groups are attached to pyridine ring, and here in the pyridoxal one hydroxyl group is converted to ketone group, that is double bond with oxygen. The other one is pyridoxamine. In the pyridoxamine the methyl group and amine group are attached to the pyridine ring. How does the absorption of this pyridoxine takes place in the body? So here the absorption of this B6 takes place in the intestine. So how does this absorption takes place? Here we can see the schematic representation. This pyridoxal, why I showed the various forms of vitamin B6 is that pyridoxine is not absorbed as such. So it is converted to other forms and thereby it is getting absorbed in the body. So this pyridoxal form, here we can see the pyridoxal which is containing the ketone group. It utilizes ATP, that is energy, adenosine triphosphate, and utilizes the kinase enzyme, and it is converted to pyridoxal phosphate. Major conversion is taking place as pyridoxal to pyridoxal phosphate, and here pyridoxamine also utilizes ATP and it is converted to pyridoxamine phosphate. Here the pyridoxine metabolism is occurring, the two forms, that is pyridoxal and pyridoxamine, it utilizes energy in the presence of kinase enzyme and they are converted to the phosphate forms. So major conversion takes place as pyridoxal to pyridoxal phosphate, and minor transformation takes place from pyridoxamine to pyridoxamine phosphate, and finally the pyridoxamine phosphate as well as pyridoxal phosphate, they are converted to 4-pyridoxic acid, which is the end product. We can say this is the active product where the absorption takes place. The absorption of pyridoxine is taking place as 4-pyridoxic acid. First it is converted to this end product and it is absorbed in the intestine. So what happens if deficiency of this vitamin of this particular vitamin occur? So when this pyridoxine deficiency occur, it increases excretion of xanthuric acid. So xanthuric acid is excreted in the urine as how the xanthuric acid is formed. So tryptophan is an amino acid. When the metabolism of this tryptophan takes place, then the xanthuric acid is formed. So here we can see the tryptophan is converted to 3-hydroxyl 3-OH chiurenine, and this chiurenine, it is utilizing PLP, that is phospholipase chain phosphate. So phospholipase phosphate. So phospholipase phosphate is an enzyme which is used for the conversion of 3-OH chiurenase to 3-OH anthranilate. So in this particular step, xanthuric acid is excreted in the urine, because in this conversion xanthuric acid is formed. So when this tryptophan when the deficiency of this pyridoxine takes place, then more amount of, we can say the metabolism of tryptophan takes place in higher amount, where xanthuric acid is formed in larger amount. So if pyridoxine is present, then it stops the conversion of this xanthuric acid. So here when 3-hydroxyl anthranilate is formed, it is converted to quinolate, and quinolate is converted to NMN, and finally it is forming NAD plus and NADPH. So this is a normal cycle. So if xanthuric acid is formed in excessive amount, it causes, if a deficiency of this pyridoxine takes place, it allows this xanthuric acid to be secreted or excreted in the urine more. If xanthuric acid is not available, then the rate limiting step, that is the conversion of anthranilate to quinolate, won't take place. It causes if the deficiency of this pyridoxine takes place, it shows some neurological symptoms also. There may be some disturbances in the central nervous system, and there will be neurological there may be neurological symptoms observed in the patient who is suffering from deficiency of pyridoxine, and it is used in demyelination of nerves. So in the nerves or in the central nervous system, there are neurons. These are the basic unit of nervous system. So these neurons contain axon, which is having a myelin sheath. So this myelin sheath, the demyelination, the removal of the myelin sheath from the axon of the neurons takes place. This myelin sheath plays a very major important role in sending and receiving the impulses which are sent by the brain. So that is the reason the demyelination when the deficiency of this pyridoxine takes place, demyelination of the nerves takes place, leading to peripheral neuritis. And here we can say if the person is suffering from deficiency of this pyridoxine, then he will have mental confusion, irritability, and nervousness and depression can be observed. So here we can see what happens if the deficiency of this pyridoxine takes place because of the various CNS as well as mental confusion as well as various other complications. The person may have some sort of rashes on the face as well as on the tongue also. We can see the patchy formation on the tongue. The next vitamin is vitamin B7 or biotin. So this is the another vitamin in the vitamin B complex. The sources of this biotin are liver, kidney, fish, liver, kidney, we can say the liver, kidney of the various other chicken or mutton or whatever it may be, the liver or the kidneys of hen or goat or sheep. These have very rich source of biotin. And in fish, egg yolks, milk, tomatoes, soya bean as well as whole grains. So in these the biotin is present richly. This is the structure of biotin. And biotin, if it is present in the body, it is stored in the liver as biotinyl 5-adenylate. So biotin is converted to biotinyl 5-adenylate and it is stored in the liver. And this biotin, it is a major important, or else we can say it is a coenzyme in catalyzing carboxylation reactions. So there are various biotransformation reactions. So carboxylation reaction is one of the biotransformation reaction which utilizes biotin as a coenzyme. So this biotin, which is utilized as a coenzyme, it is a complex of various enzymes. So let us see what are the enzymes. Biotin carrier protein, biotin carboxylase, biotin acyl transcarboxylase. So this is a complex of, or else we can say biotin coenzyme is a complex of all these enzymes, and it is required, or else we can say the daily requirement of this biotin is about 200 to 300 microgram. So here, apart from that complex, this biotin is, we can say biotin is utilized in the various pathways. For example, in the pathway of amino acid metabolism. So amino acids like valine, isoleucine 309 and chain fatty acid metabolism. So in this metabolism, the propionyl coenzyme A carboxylase enzyme is a very we can say rate limiting enzyme. So where the conversion of propionyl coenzyme A to methyl malonyl coenzyme A is formed. So this step occurs in the amino acid as well as fatty acid metabolism. So in the carboxylation reactions, biotransformation plays a major role. Biotin plays a major role. The other one is in the fatty acid synthesis, the conversion of acetyl-CoA to malonyl-CoA in the presence of an enzyme called as acetyl-CoA carboxylase. This is also rate limiting step in the fatty acid synthesis. And in leucine catabolism, in leucine breakdown, the conversion of beta-methyl crotonyl coenzyme A to beta-methyl glutaryl coenzyme A. So in this conversion, it utilizes an enzyme called as beta-methyl crotonyl coenzyme A carboxylase. So in all these biotransformation reactions, the biotin plays a major important role. So what happens if deficiency of this biotin takes place? So if biotin deficiency takes place, then it causes hollow carboxylase synthesis in the children. So in children, what does it do? It synthesizes some new enzyme called as hollow carboxylase synthase, where it is, or else we can say it stops or it inhibits various carboxylation reactions. So this biotin, if deficiency occurs, if this new product or new enzyme is formed, then various biotransformation reactions which are involved in where biotin is involved, that rate limiting enzymes will be stopped. So in the children where this enzyme is synthesized, fat metabolism, amino acid metabolisms will be improper. And apart from that, it is occurring in sulfonamide treatment, also called as, in sulfonamide treatment, if a person is given sulfonamides, then also biotin deficiency takes place, and where because of that the intestinal flora are killed. Intestinal flora are very useful, or as we can say they are essential to the body, but if this intestinal flora is killed because of the deficiency of this vitamins on treatment of sulfonamides, then it leads to various other disorders also. So this biotin is richly present in raw egg yolks. So if a person takes raw egg yolks, then the deficiency of this vitamin can be reduced. So what are the symptoms of this biotin deficiency? If a person is suffering from the deficiency of biotin, what are the symptoms can be observed? First thing is retarded growth. So the person will not have proper growth. Dermatitis. So dermatitis again is a skin inflammation condition, and alopecia, and loss of muscular control, and immunodeficiency disease. So these are the symptoms. If a person is not having biotin in proper amount, then the person may suffer with immunodeficiency disorders. His immune system will be very weak. The other vitamin of vitamin B complex is vitamin B9 or folic acid. So this folic acid is richly present in the offal, fortified cereals, green leafy vegetables, potatoes, bread, milk, as well as wheat germ. This is the structure of folic acid. So let us see the functions of folic acid. So this folic acid is very important in the formation of red blood cells. So the red blood cells are formed in the spinal region of the in the human body. So in the formation of these red blood cells, this folic acid or folate plays a major important role, and it is essential for the synthesis of DNA as well as RNA. So in the synthesis of DNA as well as RNA, not only the human beings but also in the other organisms, this folate or folic acid plays a major important role, and it is also used in the development, or as it is very useful in the development of the brain, spinal cord as well as spine in the infants. In the newborn babies or while baby is developing, it is very useful in the development of these brain, spinal cord as well as spine in the babies. As well as it also plays a major role in various severe heart attacks and strokes. We can say it is very useful in cardiovascular diseases. If a person is suffering from any cardiovascular disorder, definitely the folate supplement is given for that particular patient. Let us see the properties of this folic acid. So this folic acid is water soluble and it is resistant to acids. So here in few B vitamins we saw that they are degrading in alkaline condition, but here it is degraded, or else we can say it is unaffected by acids. So in acidic condition also this folic acid will be stable, or it remains stable, but it is sensitive to light and oxidation. If folic acid is subjected to oxidation, or if it is exposed to light, then degradation of this folic acid takes place. And this folic acid is recommended at the dose of almost 300 microgram for every day. Let us see the stability of this folic acid. So this folic acid is very stable to heat. So whether if it is exposed to higher temperature also, the folic acid structure is not affected, as well as, but it is sensitive to light. So when it is exposed to light, it gets degraded and it is easily oxidized. What are the factors which are causing, or as we can say, what are the factors which causes the deficiency of this folate? We can see during pregnancy. So a pregnant woman needs more folic acid. So this folate is very useful, or we can say in the pregnant woman, while the developing of the baby, the folate is required for the development of this brain, spinal cord and spine. So that is the reason the pregnant woman requires more folic acid. So if they don't take folic acid in the proper amount, then the development of the brain or or spinal cord will not take place in the newborns, and it is defective, or else if the folate deficiency occurs, or else we can say if there is any disturbances in the GIT region also, this folate is no, the folate deficiency will not take place, because folate is absorbed mostly in the intestinal region or GIT region. So if GIT irritation or GIT disturbances occur, then the folate is not absorbed properly. So in that condition, folate deficiency takes place. And in the resection of jejunum, so jejunum is the intestinal region where the absorption of this folate takes place. So resection, when jejunum is removed with surgery, then also this folic acid deficiency will take place. And in a condition called as spina bifida, we can see, we'll see that in the deficiency. The next condition is like there are various drugs which causes deficiency of this folic acid. For example, anticonvulsant drugs. So when these anticonvulsant drugs are given to the patient, then these anticonvulsant drugs show an effect called as folate deficiency. Apart from that, in various hemolytic reactions, if excess of hemolysis takes place or excess of breakdown of blood takes place, so because folic acid is very important in the formation of blood, when the hemolysis is taking place, then the folate deficiency is occurred. Here, what happens if deficiency of folic acid takes place? So this folic acid deficiency leads to anemia, because it is mainly useful in the formation of blood. When the folate is not, or else folate is deficient, the blood formation will not take place. So it leads to, there are various types of anemia: microcytic, macrocytic, pernicious anemia, megaloblastic anemia, sickle cell anemia. So a deficiency of folate leads to pernicious anemia, megaloblastic anemia, as well as this macrocytic anemia. So what is this macrocytic anemia? So macrocytic anemia is a condition where the red blood cell size is larger than the usual. So the usual size, the normal size of RBC is about the 500 Daltons. So 5,000 Daltons. So that is a molecular weight. So the size of this red blood cells exceeds than its normal count, there's normal size, then this macrocytic anemia will lead or will occur. And it is also used in various other WBC cell count, or else it decreased cell count, that is pancytopenia, where all blood cells are affected, and leukopenia, where the WBC decreases takes place, thrombocytopenia, where the platelet count is reduced, and it leads to neural tube defects, that is there will be improper development of brain, spine, spinal cord, and spina bifida. Spina bifida is a birth disorder where we can see split spinal cord, or else in by birth, if a baby has split spinal cord, there occurs a tube formation, or else a bulb formation at the spinal cord region where the spinal cord is split, or else where the spinal cord split is occurred, there the bulb formation will take place. So that is called as spina bifida. If folate deficiency occurs, then in the newborn, spina bifida can be observed. And in anencephaly, this is a condition where most of the neural system is not developed. We can see in the in the diagram which is shown first. So anencephaly, this is a condition, this is a condition where the nervous system will not be developed. The next vitamin is vitamin B12 or cyanocobalamin. Cyanocobalamin is richly present in non-vegetarian source, or else we can say it is richly present in meat, offal, fish and cheese. But there is no vegetarian source of cyanocobalamin. So that is the reason in vegetarians the cyanocobalamin deficiency is more. This is the structure of cyanocobalamin. It is a very complex structure because this cyanocobalamin is also very useful in the formation of hemoglobin. That is, indirectly it is useful in the formation of blood. What are the functions of these cyanocobalamin? So the cyanocobalamin, as I told you, it is very useful in the red blood cell formation, and it is also useful in the nervous system proper function. And we can see in the nervous system, as I told you, neurons are present. So these neurons, the axon of neurons contain myelin sheath. So the myelin sheath formation also takes place with the help of this cyanocobalamin, and it is helps to treat pernicious anemia. So pernicious anemia is a condition where the red blood cell count is reduced. So in pernicious anemia, if cyanocobalamin is given, then the red blood cell count will be normal. So what are the properties of this cyanocobalamin? So cyanocobalamin is water soluble and heat stable up to 100 degrees. So 100 degrees and below, it can resist heat, but above 100 degrees, if it is exposed to higher temperature greater than 100 degrees, then this cyanocobalamin is getting degraded, and it is affected with strong acids as well as alkalis. So in highly acidic as well as highly alkaline condition, this cyanocobalamin will be degraded. And they say it is affected with light, in the sense it is photosensitive. When it is exposed to light also, it is degraded. And the daily requirement of this cyanocobalamin is about 3 to 4 microgram. Absorption. How does the cyanocobalamin is getting absorbed? So for the absorption of the cyanocobalamin, 3 factors are very essential. One is HCl, the other one is pepsin, and the other one is intrinsic factor. So HCl is released from the the HCl is released from the parietal cells of the stomach or else gastric region, and pepsin is released from the enterochromaffin cells, as well as intrinsic factor is released from the chief cells of the stomach. Here we can see the flow chart or schematic representation of absorption of cyanocobalamin. Through diet, the cyanocobalamin is attached to proteins first. So after we intake the proteins which are present in the body, the cyanocobalamin gets attached to those proteins which are present in the stomach. So these stomach proteins, the vitamins, when attached to the stomach proteins, they undergo some reactions. That is, due to the presence of stomach proteolytic enzymes, they break down the vitamins and proteins. So when this vitamin is break down from the protein or dissociated from the protein, it go and binds to the intrinsic factor which is released from the chief cells of the stomach. So when this when this B12 is forming an intrinsic factor in the presence of glycoprotein, so this glycoprotein is released from the parietal cells of gastrin again. So in this presence of glycoprotein only, the B12 can get attached to the intrinsic factor. When this glycoprotein is absent, then this complex is not formed. So this vitamin B12 is attaching to the intrinsic factor, and thereby it is forming a complex of intrinsic factor and vitamin B12. So what are the we can say the vitamin B12 exists in 2 coenzyme forms, that is methylcobalamin and 5-deoxyadenosyl cobalamin. So this cyanocobalamin is existing in 2 forms, enzyme forms. So these 2 enzymes are very essential in the biotransformation reactions. Let us see that how methylcobalamin is formed. So here in B12, cobalamin, when it is reacting with methyl tetrahydrofolate in the presence of, or else we can say in cytoplasm, in the cytoplasm of the cell, when this cobalamin is combining with methyl tetrahydrofolate, it forms methylcobalamin and tetrahydrofolate is released. So where does these enzymes are required, or where does this biological, or what are the biological functions of this vitamin B12? Now we can see it is participating in methionine biosynthesis. So methionine is one of the amino acid which is biosynthesized, or else which is synthesized in the body itself. So it requires the enzymes called as methyltransferase and methylcobalamin. So here the homocysteine, when it is combining with N-methyl tetrahydrofolate in the presence of the enzyme methyltransferase as well as methylcobalamin, it is forming methionine and tetrahydrofolate. So here in this conversion, or else in the biosynthesis of this methionine, this methylcobalamin plays a major important role. And methionine is a lipotropic factor, or else we can say that this amino acid is very important factor in order to reduce fatty liver, that is inflammation of the liver. So if a person is suffering from fatty liver, he is given methionine supplements. So if cyanocobalamin is present, or else we can say if cyanocobalamin deficiency occurs, then the person may suffer with fatty liver also indirectly, because it is the rate limiting step in the formation of methionine. So here we can see the schematic representation again, where homocysteine is converted to methionine in the presence of methionine synthase, and where the vitamin B12 is essential, where methyl vitamin B12 is converted to, it is utilizing the vitamin B12 as cyanocobalamin in the formation of methionine. So what does it do in some bacteria? So not only in human beings, but also this cyanocobalamin is useful in some bacteria also. So in some bacteria, it is useful in the synthesis of DNA and RNA, so which are very important. So in the DNA and RNA synthesis of this DNA and on the formation of this DNA and RNA, the replication of the bacteria takes place. So in this DNA and RNA formation, the cyanocobalamin plays a major important role in bacteria. What happens if deficiency of this vitamin B12 takes place? So if deficiency of this vitamin B12 occurs, it leads to megaloblastic anemia as well as pernicious anemia. So pernicious anemia, as I told you, it is the decreased red blood cell count, as well as megaloblastic anemia. So megaloblastic anemia is a condition where the DNA synthesis is inhibited, which is useful in the formation of RBC. So in the red blood cell formation, the DNA synthesis is inhibited, and thereby the formation of the red blood cells will not take place. So this is called as megaloblastic anemia. And apart from that, this pernicious, it is causing pernicious anemia. So this pernicious anemia is mostly observed in the elderly patients who are about 60 years. So apart from that, this cyanocobalamin deficiency, as I told you, it is also leading to fatty liver. So why this fatty liver is caused? Because of the deficiency of methionine. So this methionine is formed with the help of cyanocobalamin. So indirectly it is causing fatty liver. The cyanocobalamin deficiency occurs if the antibodies are released against the parietal cells. So the parietal cells, if antibodies are released against these parietal cells, then the secretions from these parietal cells will be reduced. And not only the autoantibodies, if cyanocobalamin deficiency occurs, automatically the antibodies are released. But the antibodies are even released against intrinsic factor also. If cyanocobalamin deficiency occurs, then intrinsic factor as well as the secretions of this parietal cells will be decreased. And if there is any GIT irritations also, the cyanocobalamin deficiency occurs, because cyanocobalamin absorption takes place in the GIT region with the help of HCl, pepsin and intrinsic factor. And apart from that, there are drugs which causes deficiency of this cyanocobalamin. The drugs like anticonvulsant drugs, anti-epileptic drugs, and fenformin, neomycin, cholestyramine, and para-aminosalicylic acid. So these are few of the drugs which causes deficiency of this cyanocobalamin. What is the treatment? Or else there is a treatment available for this deficiency of cyanocobalamin. So we can say megaloblastic anemia. So the megaloblastic anemia is a result of the cyanocobalamin deficiency. So this can be treated by giving folate alone, because folate is also useful in the synthesis of RBC. So this folate alone can be given in megaloblastic anemia condition. And apart from that, if folate is given also, folate is given in megaloblastic anemia also, we can see some sort of lesions in this megaloblastic anemia conditions. So these lesions cannot be improved, or else these lesions cannot be we cannot treat these lesions in megaloblastic anemia condition. And the dose of this folate given is about 100 to 1000 microgram of B12 is given in intramuscular route. So apart from folate, if this vitamin B12 is also given in megaloblastic anemia condition, in that the dose is about 100 to 1000 microgram, and it is given only through intramuscular route. Let us see the other vitamin of water soluble. In water soluble vitamins, we have vitamin B complex as well as vitamin C. So let us see about vitamin C, which is also called as ascorbic acid. So this vitamin C is a rich source of citrus fruits, and it is present in roses, it's present in black currants, kiwi fruit, green peppers, strawberries, spinach. It's present in cabbage as well as broccoli also. This is the structure of ascorbic acid. What are the functions? So let us see the functions of the ascorbic acid. So this ascorbic acid is mainly useful to prevent scurvy, and also it is very useful in the proper functioning of nervous system, and it is proper functioning of connective tissue, that is blood and lymphatic system. So in a proper functioning of blood and lymphatic system, this citrus is very useful, and it is also useful in the proper functioning of immune system. So if there is any deficiency of this ascorbic acid occurs, then the person becomes immunodeficient. And apart from that, it is very useful in a wound healing, or else if a person is having some injury or damage, it is very useful in healing that wound or injury. If ascorbic acid is given, the wound or injury can be healed, and it is a very good antioxidant. So this is the only vitamin, or else we can say this is the only water soluble vitamin which is a very good or effective antioxidant. It has the antioxidant property, and it also protects HDL cholesterol. So in cholesterol, in blood also we have various cholesterols, HDL, LDL, VLDL, as chylomicrons. So LDL, VLDL and chylomicrons are harmful to the body, whereas HDL is very good or is very useful to the body. So it protects the HDL cholesterol, and it maintains the HDL cholesterol in the circulatory system. Let us see the properties of this ascorbic acid. So this ascorbic acid is a water soluble vitamin, and it is destroyed in alkaline condition. So in highly alkalic condition, because as it is an acid, when in highly alkaline condition, this acid neutralizes with the alkali, and thereby it gets degraded, and it is very sensitive to light and oxygen. So when exposed to light and oxygen, it combines or else it gets degraded, and it acts as an antioxidant. And the daily recommended dose of this ascorbic acid is about 30 to 60 mg. So these are few of the metabolic reactions where this ascorbic acid is used. For example, the metabolism of collagens by utilizing the enzyme called as hydroxylase. So this hydroxylase enzyme is very useful in the hydroxylation reaction of lysine and proline amino acid. So in this metabolic reaction, then this vitamin C is very useful, and in the metabolism of tyrosine by utilizing the enzyme called as hydroxylase homogeneous oxidase and dopamine beta hydroxylase, and in the metabolism of bile acid by utilizing the enzyme 7-alpha hydroxylase, and by the metabolism of this enzyme, whatever is there, 7-alpha hydroxylase, if it itself undergo metabolism, then it forms FH4, that is folate reductase enzyme. And in the metabolism of tryptophan, utilizing the tryptophan hydroxylase enzyme, and in biological oxidation, utilizing the enzyme called as cytochrome oxidase. So in various of these metabolic reactions or biochemical transformations, this vitamin C play a major important role. And apart from these metabolism, how does vitamin C is useful? So this vitamin C is useful in bone formation. So in the growth or development of the bone, the vitamin C plays a major important role. And in the formation of iron, iron is very useful in the formation of hemoglobin or blood. So the iron, that is Fe3 plus, is converted to Fe2+, and this Fe2+, if we see the hemoglobin structure, the Fe2+ atom is centrally present. So this is very useful in the formation of hemoglobin and blood. So that is the reason ascorbic acid also plays a major important role in the formation of this blood or in the iron absorption also. And it is converting methemoglobin to hemoglobin. So hemoglobin is converted to methemoglobin and methemoglobin is converted to hemoglobin. So in this conversion, ascorbic acid plays a major important role, and it is having a very or else we can say it is a potent antioxidant, and it is useful in the prevention of formation of cataract. So as I told you, cataract is a condition where cloudiness of the eyelids takes place. So in that prevention of this cataract, ascorbic acid is very useful. Apart from that, this vitamin acid is very useful in cardiovascular disorders also. So if a person is suffering from cardiovascular disease or disorders, the vitamin C is recommended, and it is it is very useful in reducing the risk of coronary heart diseases. So in any cardiovascular disease, whether it may be coronary heart disease or congestive heart failure or in hypotension, so in all these conditions, so ascorbic acid is recommended. And this vitamin C C is very useful in the synthesis of immunoglobulins. So immunoglobulins are we can say the components of the immune system. So this immunoglobulin synthesis is well formed, or else we can say the formation of this immunoglobulins occurs very good in the presence of ascorbic acid. What happens if deficiency of ascorbic acid takes place? So it leads to a condition called as scurvy. So if the deficiency of vitamin C takes place, the scurvy can be occurred, and this deficiency usually occurs in the infants of about, or else we can say in the children of 6 to 12 months of age. And apart from that, if infantile scurvy is if infantile scurvy condition is worsened, it leads to Barlow's disease. What are the symptoms in adults? We saw in children or in the infants it leads to scurvy. But in adults, what happens if this vitamin deficiency or vitamin C deficiency takes place? So it leads to microcytic anemia. So microcytic anemia is a condition where the size of RBC is reduced, or else the size of RBC is small when compared to normal RBC. And apart from that, the person will lose the teeth and he will have fractures, or else we can say the as vitamin C is useful in the formation of bones. So if deficiency of this vitamin takes place, then it leads to the fragile bones, and it will be there will be poor wound healing, because this vitamin C is very good, or else it is effective in wound healing. So if an adult is suffering with the deficiency of vitamin C, then wound healing will be poor.